We're taking a look at what's happening in the Ashanti region. That's becoming or giving us a rather worrying trend as far as infections and behavior, everything in between. I'm going live to Ohiming Teria, who is standing by for us, joining me live. Ohiming, it's good to have you this afternoon. You've been taking a look at how people are observing the safety protocols. Tell us what you've observed.
Thank you, Gifty. The observance of the safety protocols has been the headache of the Ghana Health Service, an issue that the Regional Health Director, Dr. Emmanuel Tinkran, says he has reported it to the Ashanti Regional Minister, Simon Osei-Mensah, for an immediate address to the problems. And when we hit the streets of Kumasi, especially the central business district of Kumasi, I mean Adum, and the new Dr. Mensah market areas, people out there are not responding. They are not observing the social distancing protocols as announced by government. And then quite a number of people are not in nose or face mask. That has been the situation in Ashanti region. So I must say, around the central business district of Adum, if you count 4 people, you are likely to get at least 3 people who are not in face masks.
And that's very worrying. But on this show this week, we've spoken to communication and public health experts who have said that we need to, you can't really force people. I mean, you need to enforce laws or create laws that are enforceable. Do we even have enough policemen to go around enforcing and making sure that people are wearing masks? What are the authorities there doing? Are there any strategies they are employing to deal with this, to get people to at least budge?
For police, we haven't had the opportunity to speak to them, but from the information that I picked from the Regional Health Director, he says he has already informed the Ashanti Regional Minister, Simon Osei-Mensah, who also happens to be the chairman of the Regional Security Council, for immediate attention to the problem. And it's not only people who are trading in the central business district or at the markets, but in some parts of offices of the Ghana Revenue Services, especially outside their offices, there are people who have ganged up trying to get registered for a TIN, that's a tax identification number, and many of them that I saw today were not in nose mask, but they have grouped. These are a large group of people who had grouped in an attempt to get the thing. So these are concerns that the Health Directorate is not happy, and we want the Regional Security Council to address it. Dr. Emmanuel Tinkran was particular about the fact that recently, when RESEC came out with a directive that police should arrest people who are not in face mask and ask them to do menial jobs or custodial sentences across the streets, where they will sweep and then clear the weedy places. That came up, and human rights activists were on the sleeves of the police and then the Regional Security Council. So he thinks that this is the time for us to ignore all these human rights calls and concentrate and pay attention to our health. He says, yes, if you manage to adhere to all these protocols, nothing will happen to you. You will not die. So it is better to live, to enjoy life, than to not to observe these social protocol issues and then come out, and also health and the human rights perpetrators will be also against all this. So he thinks that, yes, it's not an issue of human rights, but it's an issue of health that everybody has to be on board. Gifty.
Thank you for that. You indicated something that's pretty interesting. The Ghana Revenue Authority office, you said, when you passed by, had people cramped up trying to register for TIN numbers. Was there some sort of announcement for them to come, or what will give us a mental picture of exactly what you saw?
When I spoke to a couple of them off record, they told me they are there to register for the TIN number to enable them benefit from a package that government has announced for small businesses as part of mitigation avenues for COVID-19 on small businesses, the impact that COVID-19 has had on small businesses. So these petty traders who had gone to the Ghana Revenue Authority's offices to register for the TIN number, I'm told the TIN is a first requirement that every member of the public who want to register or apply for funds will have to get before funds can be processed or can be allocated to you. So in the offices itself, it's not an issue, but just outside the premises of Ghana Revenue Authority, I must say it was just behind the walls. That is where you see a lot of the traders who have massed up. Some were waiting for their turn because the place has filled up and were waiting to be called to these offices. They had massed up in anticipation that they will be called. And it's not just a concern for me as somebody who observed the situation, but a concern to the Regional Health Directorate. And they says they have reported it to the Regional Health Minister for redress. And let me also emphasize that out of the 27 districts that we have in Ashanti Region, 21 have already recorded COVID-19 cases in Ashanti Region. Gifty.
21 out of 27 districts have all recorded coronavirus cases. Now, for the Ghana Revenue Authority offices in Kumasi, we urge you to take charge of the situation and try and work it out if you can. If these people can register at least online, perhaps we can deal with a lower risk of infection. But Ohime, back to you. What do we know about the doctor who died, the SDA services doctor who died? We understand that he was buried today.
Yes, Dr. Harry Owusu-Boateng, the 48-year-old medical superintendent of the Kwadaso SDA Hospital, was buried today in the Ija in Kumasi. That is information we picked from the Ghana Health Services and also from the Kwadaso SDA Hospital. And I'm told everybody who took part in the burial service monitored by Ghana Health Services and the environmental health officers adhere to the social distancing protocols and the protocol on funerals. So yes, Dr. Harry Owusu-Boateng has been buried. Meanwhile, the hospital says it is also collaborating with the Ghana Health Service, the Regional Directorate, and the Kwadaso Municipal offices to ensure that patients who had come into contact with the late Dr. Harry Owusu-Boateng would also be tested. So they are making efforts to trace all the patients, not only the over 200 hospital staff who work with Dr. Harry Owusu-Boateng had been tested, but patients believed to have come into contact with him before his death will also be traced and tested if possible. Gifty.
Now to the Ghana Medical Association, we have a statement from the Accra arm or the Accra wing here, but the Ashanti Region GMA has been sharing some figures with you. Take us through those figures.
The figures, as far as, for instance, on treatment center is concerned, is that in the whole of Ashanti region, there are two treatment centers. The Kumasi South Treatment Center, which has 20 beds, and the Konfanochi Teaching Hospital, also with 18 beds. Now the treatment center is full. That is what the Ghana Health Service says. Now, health authorities are also making feverish efforts to expand these treatment centers to 138. So what it means is that they will have new treatment center at Suntresu Government Hospital. That will be 7 beds, and then another 20 at the Kumasi South Hospital. And they're also looking at a private facility where they've arranged with a private medical practitioner to release a place for to be used as a treatment center. So authorities hope that with this, they can have as much as 138 beds treatment center, but that is not enough. In terms of ventilators that can take care of the critically ill patients, at Konfanochi Teaching Hospital, there are only 4 ventilators. Unfortunately, the Kumasi South Hospital has none of the ventilators. So Dr. Tinkran says residents of Kumasi, and especially those in Ashanti region, should be more concerned. Now it is time for them to do something to also to complement the efforts of the Regional Health Directorate. It's like Ashanti Region don't have enough health facilities, unlike other regions where people can turn up to in terms of the needs. So that has been the worry of the Regional Health Directorate. And then in terms of the number of health workers who have contracted COVID-19, the number stands at 97. Majority of them are nurses, 47 of them, and then 18 are medical officers. Apart from this, there are other health professionals who have also contracted the disease. Amongst them are disease control officers. 3 of them have contracted the disease in Ashanti Region. We have HR practitioners and orderly personnel and the rest who have also contracted the COVID-19 in Ashanti Region.
Okay, Ohemi, so let me just clear this out once and for all. In the Ashanti Region alone, 97 health workers have been infected. 18 of that number are doctors.
Yes, Gifty.
Okay, I just wanted to clear it out. So the 97 figure we know now from the Ghana Medical Association in the Ashanti Region represent health officials generally who have contracted coronavirus, but 18, a good 18 of these people are doctors. So Hemi, before I let you go, and finally for me, what are people saying? What is the sort of conversation that people have looking at all that's happening? Komfo Teaching Hospital is complaining. We've had the health authorities there complain about how the treatment centers need to be expanded. Obviously, they're running out of space. What are people saying?
For residents of Kumasi, they seem not to care or bother about the development because not enough has been said about the current conditions to them as far as the management of the COVID in the region is concerned. What they do know is that yes, they've been told to put on their face mask, they've been told to social distance, and they've been told to wash their hands. In all these protocols, they seem not to care about adhering to these protocols. And I do side with Dr. Emmanuel Tinkran. At a point, he sounded too worried. And he says that, yes, the health officials did not anticipate that the Ashanti region will record these high figures as far as the measures that they have put in place to manage COVID-19 was concerned. So it's a concern to the health officials, but to the general public, not so much of a concern because when we hit the central business district, for instance, people were busily going about their trading activities. They seems not to care. Even those who had the face mask had either put it around the chin or maybe it was just hanging loose their neck. So yes, they are there. They've heard a lot about COVID-19, but as far as the current situation is concerned, they haven't heard enough. They haven't heard a lot about it.
Ohemi, thank you so much for the great job you're doing on this particular beat. Ohemi Interior is on our health desk, bringing us up to speed on what's happening and rather the apathetic behavior of a lot of people towards the safety protocols. Well, the health authorities are saying that this is the reason why we are where we are.